Welcome. Thank you for being here. Thank you for the opportunity to say a few words about an exciting day for us. There's been lots of discussion about where we are economically, or price of oil, those kinds of things. This is a different day. This is a day when we announce some really good news. We're excited about the, one of the campaign commitments that Byron Malott and I made is that on day one we would begin the process on implementation of expanded Medicaid, and we were happy to do that on day one when I announced Val, where are you? Val Davidson coming on board. That was a great step in the right direction. Today we talk about releasing a report that's been done by her department internally about the about how we're doing, what it's going to do for Alaska, what it's going to do for Alaskans. It's going to show that 41,000 Alaskans will benefit from expanded Medicaid. That's a big deal. That's a really big deal. And we're gonna lots of discussion about the economy and what the expanded Medicaid does. It helps Alaskans, and a healthy Alaskans is a healthy economy. And it's going to bring. It's not about just bringing revenue and jobs. It's about doing what's the right thing to do. And so I've always said that we're not going to balance the budget on the backs of Alaskan health care. That those that need the health care are going to have the health care, and we're very, very pleased to have the team that's been put together. They're actually going to show cost savings as a result of the expanded Medicaid. There will be cost savings in our budget, which is a big issue. That's very important. So the Alaska Mental Health Land Trust has graciously offered to cover the cost of implementation administratively. That's one of the pushbacks we've received in the past, so I'm very pleased about that. Across the state, wherever I travel, somebody comes up and says, thank you. It's very, very moving for me to see what a team can do when you're on the path of what's best for Alaska. So I'm so fortunate to have the team that I have, the team that Val has put together, the team of healthcare providers across the state, concerned citizens. I'm constantly approached by one of the 41,000 that do not have healthcare coverage now, that are so appreciative of they have hope of having healthcare coverage. So I'm very excited about being able to. This is a day we've worked hard to be able to be ready for, and I'm just so excited about asking my good friend, your commissioner, Val Davidson, to come up and say a few words. Val.
Poyana, Governor Walker, what a great day this is for Alaska. To the many, many people in this room and around the state who have really pushed for Medicaid expansion for the last several years, because as Alaskans we know that we can count on each other to help each other, that when things get tough and things get tight, real leaders don't walk away, they step forward. And I just wanted to express my appreciation for an incredible leader who made that decision with regard to health care, Governor Walker. So as Governor Walker mentioned, we're releasing a couple of reports today. One is the Healthy Alaska Plan, a catalyst for reform. And as Governor Walker indicated, it's healthy for Alaska, it's healthy for the Alaskan economy, and it's healthy for the Alaska budget, because we see Medicaid expansion as a catalyst for meaningful Medicaid reform. So the other plan, the report looks like this. It is available on our website, I think starting shortly after this press conference. The part of that report is also a report that was released just now by Evergreen Economics. And it is a refresher of information that was previously done. There are a couple of reports that were done by the Urban Institute. I do want to acknowledge and thank the Alaska Native Tribal Health Consortium for that work in that regard. I see Chairman Andy Tuber here, Chairman and President, along with Roald Helgeson. Another report that was previously done was a Lewin report done in the prior administration, and we thought that moving forward we needed to have a better, more refreshed analysis of where we are moving forward. So Evergreen Economics has really been doing Medicaid analysis for our state for actually about a decade. And so they are very familiar with our Medicaid program, they're very familiar with our population, and they're very familiar with working with us as Alaskans. And their analysis undertook three analyses. First is the projection of the expansion population for fiscal years 2016 through 2021. While Governor Walker indicated that over 41,000 Alaskans are eligible, we anticipate that in the first year, about 20,000 Alaskans will actually enroll, and we probably won't necessarily have 100% participation, which is what we also see in our regular Medicaid program. The good news is if they're interested in enrolling, they can. The other analysis looked at the projection of the per cost enrollee for providing Medicaid services, and that cost is about $7,250 per person. And the third area looked at the estimates of the total spending on services, including what's the federal share and also what's the state investment for that federal return. And in the first year, the federal share is about $145 million in match, increasing to about $225 million in 2021. And what that tells us, it's over $1 billion, that's a billion with a B, dollars of new revenue coming to our state in a time where, as Governor Walker indicated, we could use those revenues in our state. The state match is about zero in the first year, increasing to about $20 million in the out years. The other good news, though, is that we've also identified some significant savings where the general fund currently pays for individuals. So we've been asked by people a lot, well, who are these Alaskans? Can you tell us a little bit more about them? Well, these are individuals who are typically working Alaskans. Nearly 44% of the newly eligible population are actually working Alaskans. They are people who work but don't have incomes that are of a sufficient level for them to be able to afford health coverage. Another 28% are actually on the job market. They're people who have either been recently employed, whether they're seasonal employees, maybe they're fishermen, or they're people who are actively looking for work. So one of the things we know is that when people don't have the health care that they need, we are all impacted as a state. These are people we know by name. They are our friends, they're our family members, and they're our neighbors. They're people that we interact with every day. Whether you're the healthcare provider providing care to the underinsured or uninsured, and you are providing a significant part of uncompensated or charity care, whether you're the business owner who feels the impact of a worker who's sick and when their employees can't get the care that they need, or maybe you're an individual who had to reduce your work hours or maybe quit working altogether because of unattended health issues. We want Alaskans to be healthy. We want them to be able to contribute to our economy. And what we know is that people can't work, they can't hunt, and they can't fish, the things that make Alaska great, if they're not healthy enough to do so. And this is something that we can do for our fellow Alaskans to be able to help with that. And we can do it while saving state general fund dollars. One of the things that has been hard in just looking at our past and where we are is that expansion has been available to Alaskans with the 100% federal contribution since January 1st. If only we as a state had been ready to move forward. And for 397 days today, thousands of Alaskans have gone without access to health care coverage. And that's got to change, and that's going to change thanks to the leadership by our governor. So the other good news is we've also identified some pretty significant savings, and Alaska actually saves general fund dollars by covering this new population. And so the initial savings in the first year are about $6.1 million during the first year of expansion alone, including $4 million in savings in the corrections budget, $1 million in catastrophic and chronic medical assistance program, and $1 million in behavioral health grants. And they exceed the initial administrative costs. And in the out years, those offsets actually increase to about $24.5 million in savings in offsets, resulting in savings of about $3 million in the out years. And those are just in a few categories. We know that we can identify additional savings in the out years. We do have to, maybe it's somebody calling saying they're ready to sign up, which would be great. We'll be ready this summer. So we also want to, as Governor Walker indicated, we also want to thank some incredible partners, many of whom are here today. We want to specifically thank the Mental Health Trust Authority. The trustees at a recent meeting agreed to provide the funds necessary to cover the first year of administrative costs. Maybe they have a spouse they'd like to sign up. So the other part of it is that we know that expansion is really the first step, but we also have to talk about what are we going to do down the road. As Governor Walker mentioned, we have a price per barrel of oil challenge at the moment. I heard it did come up a little bit, but we know that when these challenges happen, just like we do in our own homes, when our resources get tightened, it also allows us the permission and the requirement for us to be bold and to be innovative. And so we are undertaking a reform plan that, again, thanks to the Mental Health Trust Authority, they have funded the opportunity for us to be able to engage stakeholders and look at what other states are doing so that we can develop an Alaska plan. It's funny because every time a new state comes on board with a new Medicaid expansion plan, and whether it's a waiver, somebody will stop me in the hall and they'll say, "Hey Val, have you seen that Indiana plan or that such and such state's plan? Maybe we ought to do that here. Can't we do that tomorrow?" Well, the truth is, other states have really been working for expansion for years. And our governor has been here for about 2 months, and I've been there with him. And, we can get a lot done in 2 months, but probably what has taken other states years to do is probably not necessarily doable. And we also know from experience that if we take a plan that's designed in another state and drop it here in Alaska, we've tried that before. We've done that before. Alaska is unique. We say that all the time. Our population is small and our geography is vast. We're very rural in nature, and we need to take the time to develop an Alaska plan, one that is responsible and ensures that while we can take measures and do the analysis to bend the cost curve for Medicaid, we also want to make sure that individual Alaskans aren't adversely impacted. So what are those building blocks? We're looking at things like payment reform. How are we paying for services? Is there a way that we can do that where we can focus on prevention? Strengthening primary care. Are individuals in our state, do they have access to a primary care provider, whether that's a community health aide, whether that's a nurse practitioner, whether that's a physician? How are we doing that? And also care management, making sure that people get the right care in the right setting and at the right time. And typically that also means at the right price. And also workforce innovation. Can we do things differently so that we are able to maximize the number of Alaskans who can provide service within their scope of practice? Some of them I mentioned before. And also, what are other federal matching opportunities that exist that will allow us to be able to do that? And then what are we doing for telehealth in our state? We have much more opportunities there. I could probably go on, but I think in the interest of time, I probably won't. But one of the things I do want to let you know is that it's pretty clear that today, we don't necessarily have all the answers for what we would like reform to be. We're really open to that. I know many Alaskans have really loved Governor Walker's commitment to transparency, and you're going to see that here with the Medicaid reform effort. And we're going to work with Alaskans and also learn from other states to be able to evaluate whether those innovations would work here in Alaska. And we are really heartened by the number of Alaskans who have stepped forward with their incredible ideas, and many of them are here today. So with that, on behalf of everybody in the state, I just want to say to you, Governor Walker, thank you very much. And you're saving lives, and it matters. And in a time when it would be easy for people to step away, you haven't. You've stepped forward. So thank you for that.
Thank you. Questions? Let me just say, when I first met Val, it's during the interview, when I was interviewing for that position, and we had like 15 minutes time slots, and it was kind of like a speed dating thing, and it was a little too fast for me. So she gave me a 15 minutes time slot. 2 hours later, my staff came and said, "You guys have to knock it off." But you know, what we did is we looked for, you know, we read the resumes and we looked for the passion. Boy. She had it on both. Incredible resume, incredible passion, incredible heart for this issue, and for this state, and for the people of the state. So it's been exciting to across the state have people say thank you for what you've done for Alaska with Val Davidson. So. And if you like Val, you'll love her mother. Her mother's awesome. So anyway, happy to take any questions you might have.
With the Alaska plan idea, is that just for the expansion population that you're talking about, or is it for the broader Medicaid?
No, I'm sorry. For the reform plan, we're actually looking at all of Medicaid. So what we would like to do with expansion is take the time to be able, while we're taking the time to develop a program for all of Medicaid in the out years, we want to make sure that we have the opportunity to expand Medicaid first and do it quickly, because our last year for 100% federal match under expansion ends December of 2016.
So you're not talking about a waiver?
Yes.
A waiver, like taking the standard model at first and then doing a waiver for a different kind of expansion down the road. Is that something that you're looking at?
I think what we're talking about right now is doing an expansion that actually mirrors our existing Medicaid program in terms of benefits, and then taking the time to develop a plan for not only expansion but also for all of Medicaid.
Could you talk a little bit more about the who will cover the cost of the administrative part of the program and how that would work?
Sure. So we have identified a few administrative costs just in additional employees to be able to cover the enrollment intake workers at the very front end, and also some additional staff to be able to do the processing of the payments. It's about $1.3 million in 2016, and that number increases to about $1.6 million in 2021. And so for the first year, the Mental Health Trust Authority has agreed to cover those costs, recognizing that it's going to take some time for that federal match to be able to come in. But in the out years, as I mentioned, the savings actually, the offsets that we identified in corrections, in catastrophic coverage, and also some grants that we believe will be able to now be able to transition to Medicaid reimbursement will be about $24.5 million, and then resulting in about $3.5 million in the out years in savings.
And how confident are you that you can make the case for this to skeptics in the legislature?
Well, I think one of the things that I appreciate about, I'm not sure if that was a question for me. I'm sorry. So, we have said from the very beginning, and Governor Walker has said from the very beginning, that we want a partnership with the legislature to be able to do this. And so Governor Walker included the resources, the receipt and spend authority for the expansion population to be able to receive those federal revenues and the 16 budget proposal. And but we also recognize that that there are some technical changes that we need to make to Medicaid under our existing statutes, because the advances in the Affordable Care Act are new, and some of our Medicaid statutes, quite frankly, are dated. And we also want to make sure that we have clear authority from the legislature to be able to move forward with reform. One of the things that I really appreciate about Governor Walker is that he's a collaborator. And I certainly see that as an opportunity to work with the legislature. And so, quite frankly, I think there are some legislators who aren't, necessarily so hot on expansion per se, but they're interested in reform. And so if the two go hand in hand, and we can show that there are savings to the state in a time where we are looking for those savings opportunities in our general fund, then I believe that they'll come on board.
How do you expand Medicaid when there's problems in the payment system currently?
So let me tell you where we are with both enrollment as well as the payment system. So having been here 8 weeks, we took a look at what we would have loved to be able to say, we're going to do expansion on January 1st. Wouldn't that have been incredible? We would have loved to be able to say maybe April 2nd, because you don't start anything really good on a foolish day, so don't start on the 1st. But we really think that in order to be able to clean up some of our backlogs in enrollment and also address some of those delayed payment issues, that we're probably shooting for July.
Let me add, that's a good question. I get regular briefings on the schedule of payments and sort of tracking of how it's going out, the improvements that are going on a regular basis. So every indication I've received is that we're on the improvement side on the problems. I've heard from vendors all over the state. Sometimes they're small, single sole proprietorships that are having a tough time. I come from the private sector, and that's what I've known all my life until this job. So I'm sympathetic to that, and so we are very focused on, and we have zero tolerance for any unnecessary delays. We did certainly evaluate whether it was appropriate to go in to start over again with somebody new. I made the decision that I was convinced that significant progress is being made, but it's not something we just sort of push off to the side and let me know in 6 months. I'm briefed on that regularly as far as the update, and they can show that. I mean, how much money went out last week, how much in the way of payments went out last week versus the week before, and I'm looking for that tracking on a weekly basis that we're improving every week, and they know I'm watching.
How close in terms of dollars or number of outstanding payments is Xerox being caught up?
I don't have the exact number on that. I continue to look for improvement in the tracking system of it, and they know that we're watching closely, and we've met with them at the highest level, and people that are frustrated about that, don't be hesitant about getting a hold of Val or me or anybody in our department, because we need to hear from you as far as there are circumstances that we want. If we don't hear about it, we're not going to know about it, and so we ask for your help in that regard. It's great to hear the successes, but we also welcome the challenges. We welcome the opportunity to address your challenges as healthcare providers, because you're on the front line for us, and so if you're not getting reimbursed, you're not getting paid, that impacts Alaskans, and then that becomes our job.
I want to open it to folks on the phone before the governor has to go.
The conference is no longer in listen-only mode.
If there are any questions on the phone, please identify yourself and your news organization. We don't have an operator, so please take your turns.
This is Becky Bohr with the Associated Press for Commissioner Davidson. When you're talking about the offset, can you? I think you mentioned $24.5 million. Is that in addition financial year? Is that overall? I just wanted clarification on the number.
No, I'm sorry. In the first year, it's $6.1 million in offsets, and in the year 2021, it's $24.5 million, based upon what we know so far. But we also know that we're anticipating identifying additional savings. But in the last 8 weeks, these are the savings that we have identified so far, and they include the catastrophic coverage, as I mentioned before, include savings for corrections, and also in grants.
Next
And
question on the
Commissioner,
phone.
is that figure included in this report, or is that something that arose from internal work within the department?
It's included in the Healthy Alaska Plan. It is included in the report.
Thank you.
You're welcome.
The governor only has time for about 2 more questions, so the rest of the folks will be around after. But another question on the phone, please.
This is Jennifer Canfield, Alaska Budget Report. I'm looking at some of the line items in the behavioral health section of the budget that was released earlier this week, and I just wanted to ask the commissioner, some of the items under behavioral health are completely zeroed out. Are those the items that you're saying can possibly be covered by this Medicaid expansion, things like suicide prevention, fetal alcohol syndrome program?
So the savings that we've identified for this are actually about $1 million in behavioral health grants. But I don't believe that those were the grants those cuts were identified. Those savings were captured here.
Next question on the phone.
Let me just add, normally Lieutenant Governor Byron Malott would be at my side in this exciting day. This has been a big issue for Byron as well. The weather plan chose to have him stay in Juneau today. The winds were a little much last night, and today the flights were canceled. So otherwise he would be here. And what Byron says so well, he says, when you're in a financial challenging times, you really need to make sure your priorities are in order, so you don't do something that's going to affect somebody else's lives in such a way, such as healthcare. So he would speak to that very eloquently, like he always does. So I wish he was here. But he sends his regrets because of the weather.
Governor, I've got a question not related to Medicaid, but about ANWR, so I apologize for bringing things down a little bit. But I've written in an op-ed in the Newsminer that the announcement about expanding work stipulations there violated the spirit of the No More Clause. I just wondered if you could explain that, maybe in terms of how you think it violates the law or the spirit of the law.
Well, when NILCA was entered into, I believe it was 1980, there was a 100 million acre provision in there, and there was a significant amount of acreage that was set aside, and there's a provision that there'd be no more without the blessing of Congress. And I know the steps that were taken on that recently by the president, begin the process for Congress to be involved. But it is clearly, I think, in violation of the No More Clause, because now what they're doing is they are treating that land as though they had received the congressional authority, according to my conversation with Secretary Jewell, and that's inappropriate. That's clearly in violation of the No More Clause. So that shouldn't be treated any differently now as a result of until Congress acts, which I don't think Congress is going to agree with the president on that. So it's a significant step, I think, overstep on their part in our ability to responsibly develop our resources.
The announcement itself in the plan.
I'm sorry?
The announcement by the president in the plan.
That's correct. Yeah.
You had also said that, elsewhere I think you said that suing was not going to be your first option, but if you were to sue, on what basis would you sue over that?
Oh, I mean, the theories I certainly would be in violation of the Statehood Compact. The Statehood Compact was something that we relied upon when we became a state, and I think that's been violated. The spirit and intent of the transfer of lands to Alaska was so that we could earn our living, livelihoods off of our resources and develop our resources. I think that's in violation of that. I imagine there'll be some litigation at some point, but that's just not the first thing I reach for. I'm still in the discussion mode. Sometimes when you start with litigation, it sort of closes doors of discussion, and I'm not done with the discussion. So we're going to Kotzebue later this month to meet with the Secretary Jewell, and certainly the delegation will be there as well, and the House and Senate leadership are going to be there as well, which I very much appreciate. They're standing united on this issue, and so there'll be more discussion. I think if you start the litigation process right away, some of those, it closes doors, and they say, well, leave it up to the lawyers. I'm familiar with that concept, and I'm not going to go down that road quite yet. So I think we still have more cups of coffee to have and more discussion to have, but it'll be a little more aggressive, I think, than my last cup of coffee with the Secretary. So.
All right, folks, the governor has to go to the next engagement, but Val and then the rest of these folks from different agencies are still available to answer your questions.